Welcome everyone. We're giving a few minutes for everyone to join. Also, in the meantime, feel free to turn on camera, say hi. Welcome again. Today we're here to talk about our new compendium and to launch them together and come together also as a community and create dialogue and talk about how we're building systems that is prepared for emergency situations. I would like to invite our program director, Mihaela Ionescu, to welcome you and say a few words to set the stage. Please, Mihaela, the stage is yours.
Thank you, Aisha, and greetings to everyone. With many thanks that you have chosen to be part of this important event, at least for us. Yes, we are launching the compendium on ECD in emergency, and it's a collective effort of our network to document and reflect actually on how we can support systems to be better prepared in emergency situations. We have witnessed and we continue to witness many emergency situations across the world and in our region, and we consider of utmost importance to flag those aspects that should be strategically addressed, not with reactive but proactive measures, to ensure that young children are free of harm, safe, and are prioritized in times of emergency with competence and ensure that their development and well-being is as we would like to see it in times of peace. We have unpacked the concept of system preparedness, and we have done that by analyzing what type of interventions have been enacted by our members from whom you will hear today, and many of them were not necessarily present today, in various countries to prevent and also to minimize the risk effects on children during emergency contexts. What needs to be in place? As we have learned and continue to learn through the many unfortunate events in these years. We can only hope that this contribution will help the various stakeholders in early childhood systems to work towards ensuring that those systems are well equipped to perform smoothly in times of crisis for the benefit of each young child. As a network, we felt responsible for driving this discussion and lead to tangible changes, as we have learned so much from the work that has been done in all these years, with members that have worked under different circumstances and have faced a lot of types of emergency situations, from disasters to earthquakes or floods to war context, as well as the pandemic that we might have forgotten about, but has left a lot of traces. So how we can have systems more nimbling, answering to so many threats that have been exposed when children have been subject of such emergency situations. We hope that the meeting today will drive further the discussion, and the examples that we will have provided through this compendium, we will walk you through it, will bring most articulated vision of how we would like systems to be prepared for such situations. Wishing us a fruitful discussion, but also inspiring examples from what has been done, but better articulated thinking of what all of us can do to have better prepared systems. Thank you, Aisha, and wishing all of us an inspiring meeting.
Thank you so much, Mihaela. I mean, welcome. I'd like to say welcome to some people who are still joining. Thank you for this opening and setting the stage and reminding us that we are all together in this as a community, and we want this to be an ongoing work all the time. And I would like to also invite during the discussions everybody to comment, reflect, and ask questions. So let's make it as much as dialogue as possible together as a group, as professionals who are working in this field. I'm going to share my screen, and just to give you an idea, what are we going to do, how this meeting is going to look like. I hope you're seeing the right screen. Yes, I hope you can see well. So today as we started with our welcomes and introductions, and quickly I will move on to launching the compendium, and I would like to show you a little bit of teaser about how the website looks like, because this website was developed with a great effort, all of us together, and also with the great input from our members and their work. So we're very excited about it. And then we're going to move on to member stories and panel discussion, where we're imagining that we're engaging in dialogue all together, and we're going to kind of find ways to inspire each other, learn from each other, and ask questions to each other, and then just create this discussion and together. And then after that, we will have like a 10-minute synthesis and reflection session where we will reflect on the next steps, what is ahead of us as a community, and then we will close the session. But first, I would like to invite all of us to do a little poll. You can use the QR code, or you can go to Mentimeter and answer the question there. One moment. We're going to also share in the chat. Yes, you have the link in the chat. Thank you, Jen, for that one. And let's have a look. I hope you can see we're getting answers. In your position as an ECD professional, how prepared do you feel to support young children in an emergency? We see around 6. This gives us an average altogether. 6.2, around 6. It's getting lower. Okay. We hope we can carry this forward as a community, that we would feel more prepared to support children. I guess we have the answers. Thank you. So we will come back to that towards the end of the session. So here to kind of test where we are again after we share our experiences and learn from each other. So without losing any time, I would like to provide an overview what we included in this compendium and how did we end up with these components. So, crisis situations, disasters, pandemics, conflicts, as Mihaela said, it's that disrupt children's and families' lives. But, preparedness isn't just a plan. So it's about building systems that are inclusive, resilient, capable of protecting every child and families in the hardest moments, and it requires a lot of effort, leadership, coordination, collaboration, and investment in different levels. In this compendium, we looked at system preparedness, by analyzing how our members and ISSA members across different countries, how they reacted, how they intervened to protect children and reduce the impact of emergencies, and created a buffer zone for them, how they actually responded to the emergency. And by this analysis, we found out that we could cluster these into these 5 components, which is you can see there, which is the first one is about emergency response. It's about the ability to quickly mobilize with clear protocols, having resources, having partnerships in place, so that when the emergency happens, it doesn't collapse in the first days of crisis. And flexible delivery, service delivery is important, because when the systems are rigid, it can break under pressure. So we need services that can be flexible, that can shift to, home visits, for example, digital learning, mobile units, and community hubs to reach children wherever they are. And the third one was the workforce capacity and well-being. For quality, as we all know in this field, it's the backbone of quality. And in crisis, it's even more important. the resilience and the skills and the emotional health, all as a whole, is very important, and it determines if the services continue at all, if the services can hold on in the case of emergency. And fourth, integrated mental health and psychosocial supports, which means support for children, families, and staff. And of course, crisis in every context, it creates a lot of stress, and there's a lot of need for emotional well-being, addressing it, and healing and restoration, education, and you know, it's important as physical safety. So it's a huge part of it to keep you know, providing and integrating MHPSS into our work. And finally, governance and coordination and accountability. As we all know, without leadership, without cross-sector collaboration, without coming together, working collaboratively, the response can be very fragmented and inequitable. So we are actually thriving for, you know, integration as much as possible and cross-sector work together. So, and now, without taking too much time, I'm excited to show you how the website looks like, where all of our members' inputs are being showcased. I'm going to close this one and open up this one. So this is how the website looks like. We envision this interactive website to be a living document, living website, growing. So our work is not done here, but it's going to, we hope that it's going to grow. So this is the homepage, and where you can do, it's actually, you can explore in different ways, this website. And it actually consists of two main parts. The first part is actually getting us on the same level of understanding what we mean as good ECD systems, and what are the roles you can explore by, you know, who is responsible for what. We just wanted to make sure that we share the same understanding, and you can also explore by system elements. We encourage you to kind of go and explore, and, you know, we talk about what are the common risk factors. So these are all learnings that we took out of from our members' work, and also our research on it. And then you can actually explore by yourself. But the main second part is about ISSA's journey, where you can explore ISSA member stories, you know, if you wish, by element of the ECD system preparedness or emergencies. You will find each one story in this section, members, how they reacted to the emergency that they had, what were in place, what were not in place. So I'm really inviting you to explore the website. And without further ado, I would like to start the discussion. As I reviewed, we're going to go in different segments in this event, talking about different emergency types. But we all know that there's a lot of common overlap, common learning between you know, disasters happening or different emergency types. So I'm inviting everyone to kind of join and ask questions. First, I would like to start with our members from Ukraine. Today we have Eleonora Kulchar with us, and they're with language issues. So I'm asking a little bit of your patience so that we can have time to translate what Eleonora can share with us. First, I would like to give a little bit of information about what is there, how we are actually showcasing their work in the compendium. So the Blaho Center, originally, they were a small education center for Roma children in Transcarpathia. And when the war began, they transformed it almost overnight to a station of hope, shelter for displaced families. They expanded their capacity by renting additional building. They turned spaces into safe hubs for learning and psychosocial support. And teachers were supported by psychologists. And they continued providing trauma-responsive education for infants to preschoolers, a wide age range also. And their work shows how flexible, community-rooted organizations can fill critical gaps when formal emergency ECD systems are lacking. So first, I would like to now invite Eleonora to reflect further on your experience. And can you please tell us about your work, which elements of preparedness you worked on, and what helped you to respond effectively, and what was missing that made your response a bit more difficult? Please, Eleonora.
Всім доброго дня. Hello to everyone. We will work in pair. Today my name is Natalia and I will be interpreting for Eleonora. Рада бути з всіма вами і щиро хочу наперед подякувати ISSA за велику вашу підтримку, за співпрацю і за великі ваші серця. I'm very glad to be here today, and first of all, I want to say a great thank you to ISSA for your support, for your cooperation, and for your big hearts. У 22-му році почалась, коли війна, ромська громада пережила дуже велике відтвердження і дискримінацію, упередження ставлення. Звісно, що діти всі також потрапили під ці загальні відношення до себе. When the war starts in the year 2022, the Roma nation, Roma children as well, they were discriminated, and the attitude was not so good in this context. І завдяки того, що фонд Благо швидко зреагувала, і вся команда наша зрозуміла, що ромів, а в частності діточок ромських, стикнула не тільки війна, але, на жаль, і відверження від общества. And thanks to the fast reaction of our charitable fund, Blago, and in the context of the problems that not only war was a problem for all my children, but also other circumstances. Ми відкрили перший в Україні шелтер на базі нашої дошкільної підготовки. We opened the first shelter in Ukraine on the base of our preschooler center for preparation these children for school. Це було пару днів після початку війни, 1 березня. І ще через пару днів ми зняли великий готель, як уже і написано там у докладі, для більшого прийому ромів, внутрішньо переміщених осіб. First of all, on the 1st of March, several days after the start of war, we prepared our building for this, and several days after that we rent a restaurant as an additional building to a place to settle these people and these children. І завдяки підтримки і партнерства з ISSA із мережею RAIN Україна, міжнародною мережею RAIN, ми змогли отримати нових донорів завдяки ISSA.
And thanks to the cooperation and support of ISSA and the RAIN Ukraine, we managed to involve new donors for this support and cooperation.
Угу. Я не помню вопрос, что там еще? Что-то еще мы должны рассказать или? Угу.
Які проблеми, з якими проблемами в частково розкрили?
Если есть вопросы, я не знаю, нужно ли...
If we can answer more deeply, please ask, because it seems to us that we answered the question, but if not, please correct or maybe you have additional questions.
Yes, before inviting the other members to reflect also and ask questions, I have a question about what was your experience about how to support the workers when they are themselves affected by the war as well? What was the challenges for you there?
Які були виклики? Перед тим, як задати, як почнуть інші колеги, інші учасники задавати питання, є таке питання. Яка була підтримка працівників?
Наш фонд підійшов до комплексного вирішення питань. Тобто ми не тільки надали безкоштовне проживання біженцям, внутріпереміщеним особам, але трьохразове харчування, психологи, також були вчителі, залучені юристи. Це була велика команда працівників, які були залучені для допомоги всім вразливим людям, які біжали від війни.
Як підтримували ми працівників своїх?
Як ми своїх підтримували?
There was a complex, the complex of different actions that was set to settle the people, to settle the children, to give them food, to give them psychosocial support, to create a bigger team for this, for everything, and to support the team.
А самої команда була дуже виснажена в роботі, тому що ніхто не був готовий до такої роботи, психологи також не були готові до роботи такої, і команда була виснажена, але завдяки тренінгам від ISSA ми змогли десь восстановитись, але це було дуже, дуже важливі ваші тренінги, які нас підтримували.
And so it was very hard for the whole team because the team was very tired, and we want to thanks one more time to ISSA for the trainings, for support in some knowledge, in cooperation, to support our team by knowledge, by some trainings, by
менторство, здоров'я, ментальне здоров'я.
To support the mental health of the team. And thank you for learning how to help us by ourselves, let's say.
Thank you so much.
Дякую вам дуже.
If we have questions from the audience, please add them in chat. But in the meantime, I would like to invite Gabriela. Hi, Gabriela. Nice to see you.
Hi.
To reflect, because Gabriela Brandt is from AMNA, and AMNA, and you have been, you have extensive experience working in emergency situations and refugees, and you have a lot. And do you have any reflections? Are there any similarities? Are there any differences or lessons that can be transferred from their story to your context? We would like to hear a bit from you.
Thank you, Aka.
Thank you.
Hi, everybody. It's lovely to see you today. So just for those that don't know, Amna's a long-standing and grateful member of the ISSA community, and our work is really focused on building what we call a therapeutically informed workforce. So a workforce of people and places from community organizations, refugee-led organizations, and also institutions existing in contexts where there is war or conflict or risk of conflict, and also on migration routes as well. We started as a direct delivery team in Greece, and then over the last 5 years have been taking the approach, which I'll share a tiny bit more about, to other contexts, and really trying to resource a workforce in those contexts where it's been identified that there is a need for this type of training and support. And so the way that we do that is by working in partnership with local organizations, and like the organization that we've just heard from, a key focus is really finding organizations who are deeply embedded in their communities, who are, wherever possible, led by members of those communities. So if it's the Roma community, led by kind of people from the Roma community, or LGBTQI, or whatever it may be refugee-led in many cases, and really resourcing those organizations through primarily training and supporting and providing supervision to facilitators, frontline workers, but also to the organization in how to provide trauma care and grief care and really healing-centered care to support people who are experiencing profound loss, grief, possible trauma. We don't know if people, that it's different for each person, and also lots of, complexity when you become displaced, whether internally or externally, also connected to identity, which is a really big part of our work, really being identity informed as well as part of the healing journey. So specifically, in terms of this conversation and emergency response, we've been doing that work in different places in the world with networks of partners. So we've been working for a long time in and around Ukraine, in Afghanistan, in Jordan and Lebanon and Palestine now, and other contexts. But I think today I'll just mention briefly the work for our Ukraine response. So when the war started, AMNA mobilizes actually our, I think, second emergency response. And really our goal was to say, can we rapidly provide organizations who are now meeting the needs of different displaced and conflict affected communities in Ukraine, outside of Ukraine, with these tools and resources, and can we give them the tools and resources quicker than we usually do, recognizing that in a emergency context, people need to kind of download what they need quickly to get on with the job. And so we took what had previously been a 2-year program, and we took elements from our training and learning journey and put it into a 6-month program. And we really tested that to say, does that work? Because we know generally for learning has a greater impact, especially when you're developing new skills, and safe practice over more time is generally better practice. But what we've ended up doing is working with nearly 20 organizations in 2 different rounds, all community organizations, a number of who are in the ISSA community, and I think possibly on the call today, and providing training in this support. And the way that AMNA then works is to say, you don't need to follow this step by step or this manual. We're going to give you lots of different resources and activity ideas and session plans and structures, but each organization is respected as the expert in their context. And so they then say, right, this is how we're going to use this. This is what's most useful to us. Then AMNA's job is to really accompany and support the safe practice. So key parts have been the curriculum that has been really co-created, with refugee communities since AMNA started. But every response we do, we kind of co-create the curriculum, and we learn more from the partners that we're working with. And then another really key part is the community of practice. So really making sure that all these organizations doing this work have a network of each other, of other organizations. So they're training and learning together, but they can share ideas, questions, challenges, and really benefit from being part of a wider community. There's opportunities for referrals within that network. So someone may say, we're really struggling with this case. Is there somebody with the clinical training who can help us think about it? Or Amna can think about it. And then what we've done now is all of our partners are invited, and it's optional to join what we call our global healing network. So then they become able to access a wider network of partners who are really committed to mental health and psychosocial care with conflict affected communities that Amna has also partnered with over a long period of time. So yeah, I think, key lessons for us were like quick mobilization. Our second response benefited from the first response because we learned more from the first response from partners that we work with. And then there's lots of logistics that we've learned from this, which is, how widely do you go? We work with quite a big cohort of partners who are in a lot of different countries. And we've reflected on, should we really focus in certain kind of geographic areas? But it's been a really, really rewarding program through which thousands of people have been hopefully supported on their healing journey.
Thank you so much for these reflections and information. We will, towards the end of the discussion, we will also come back your work specifically also in pandemic. I guess there's also a lot of learnings that happened. And also for our Ukrainian member, Eleonora, Natalia, please, and also for you, I am seeing a question: how do you manage to continue your support for the community in such a long-term unstable situation? War has no clear horizon of ending. So they made this, Philomena, Nicola, thank you for the question. They made this kind of comparison, like a pandemic or a disaster. There's like a starting point, you know what to expect, this is it. But in war situations, sometimes it's very hard to see the end. And what is the reaction that you have, what you can say on this?
Як вдалося підтримати громаду в умовах оцих всіх лих, включаючи пандемію, включаючи війну, і оці всі лиха на кучу, яка була реакція, як вдалося підтримати громаду в цих умовах?
Звісно, що були дуже тяжкі життєві визови. І завдяки нашій команді, стійкості нашій всій команді Фонду Блага і підтримки наших партнерів, це було дуже важливо. І разом ми можемо сказати, що ми пройшли разом з нашими партнерами, разом з ІСА і з остальними партнерами, хто був з нами разом і остаються разом надалі.
Frankly speaking, the times were very hard in the conditions of that challenges that we had. Thanks to the support and to resilience of our team and to support of ISSA, we managed to make it together in cooperation. With supporting each other inside the community, inside the team, and with the support of our partners, we managed to do this.
З початку пандемії нас підтримували дуже сильно мережа ІСА і мережа РЕЙН. Було надано як міні-гранти. Більш ніж 20 міні-грантів ми змогли надати для різних регіонів України, а також було проведено велике дослідження разом з університетом Барселони, так, через мережу РЕЙН і ІСА.
From the start of pandemic, we as well had great support from the side of ISSA. Thanks to that, we could spread 20 mini grants in Ukraine, and then we could make an investigation together with the University of Barcelona.
В 22-му році, коли почалась війна, було підтримано фінансова допомога була надана більш ніж 425 сімей отримали фінансову допомогу по 70 євро кожна родина отримала на ліки і на евакуацію.
After the beginning of the war in the year 2022, there was great financial support, and thanks to that, 425 families received financial support by 70 euros per family for medicines and for evacuation.
Ну і звісно, що в 24-му році було придбано велике приміщення, де ми зараз знаходимося. Ще відкриття нема, але ми вже тут. Вибачте, в 23-му році було придбано велике приміщення, де йшла реконструкція. У нас в гостях була Ліана Гент. Ми дуже раді, що вона нас посетила. І за підтримку також софінансування ІСА ми проводили закупівлю вікон і різні ремонтні роботи.
Also, in the year 2023, we bought the new building and we start the reconstruction of it for building for our new center. And we want to say thank you to Liana Gant for her visit. She was visiting us and saw when the building was in that condition. Now we are here in this building. It is not already finished, but we are in the great process of the reconstruction. And we want to say thank you for the co-financing. We want to thank you to ISSA as well.
Ключових викликів ще можу розказати, але або пізніше, або зараз, як ви скажете, звісно. І,
Concerning the key challenges, I can answer now or as you say.
Так. Ще я хочу доповнити, бо багато всього, дуже багато всього. І,
a lot of everything we have and we want to share, so I want to add something else.
Проводилася терапія як для дітей, так і для маленьких дітей була робота ранній розвиток дітей від 2 до 5 років разом з батьками, окрема арт-терапія як для дітей, так і для батьків, дошкільна підготовка, яка також продовжується, і надолуження прогалин по навчанню дошкільної підготовки, раннього розвитку.
We had a lot of activities such as art therapy, early development of children, preschool preparation for children,
шкільної.
Scholar preparation, and there are a lot of gaps in education, so we make everything to fill these gaps.
Мгм.
And that's all. That's all.
Якщо є питання, будь ласка.
If you have additional questions, please ask.
Thank you so much. Thank you so much, Eleonora and Natalia, for this overview. I'm seeing some more questions there, and I also wanted to give some space to Gabriela, but I think we can come back to the questions later on, and first make sure that we're not running behind of time, if that's okay for you as well. So thank you, Suzanne, also asking some questions. I'm parking these questions and I'm going to come back to them for sure. But first, I would like to move on with other sections so that we would have a more overall picture together. If you agree all together, I see thumbs up. Thanks. That's great. Yes. So we will come back to those. And I would like to move on with our showcasing with the displacement segment. And today we actually were we planned it to have a member from Poland, but they cannot be with us today. So I'm going to give the floor to reflect on their experience to Julia from ICDI. Before I invite you, let me give a quick overview. ICDI, together with Škola do Koran in Slovakia and Partners Hungary in Hungary, they launched Toy for Inclusion Play Hubs. They're inclusive, community-based spaces where young Ukrainian children can play, learn, and feel safe. They were designed to support families who face major barriers to enrolling formal preschool, language challenges, limited school capacity, uncertainty about how long they would stay. So what they did was they created mobile hubs to offer safe play, early learning, language support, and access to services. And, they had strategic placement with municipalities, UNICEF, and NGOs. They ensured the hubs reached the most affected areas. This model actually helped build social emotional connections for children during uncertain times. And they also helped sharing the tools like Play for Inclusion Handbook and Mobile Hub guidelines, and they are being used in similar, now used to scale similar models in other contexts. Their experience shows us how flexible ECD delivery fills system gaps, but need inclusion and national preparedness planning, actually. So I hope I could show the best of Toy for Inclusion, Julia, but I would like to also invite you to tell us a bit more about this work and tell us about which elements of preparedness you worked on, and do you see indeed similarities, differences, lessons with what has been shared so far also? Please, the floor is yours.
Thank you, Aisha, and good afternoon, everyone. I'm speaking today on behalf of ICDI as the coordinator of the Toy for Inclusion program in 9 European countries. But I'm presenting, as Aisha said, the experiences that were carried out on the ground by our partners in Slovakia and in Hungary and implemented with the support of UNICEF and World Child. Our role as ICDI was to guide the model, ensure quality, and connect local practices to the wider European and ISSA ecosystem. For those that do not know Play Hubs or Toy for Inclusion Play Hubs yet, they are community-based, non-formal early childhood spaces that bring together young children 0 to 10 with their families and local services, and they provide inclusive play, learning, and parent support opportunities with a strong focus on reaching those who face barriers to formal education and accessing services more in general. When it comes to the elements of the preparedness framework that we worked on, I think we can say that we worked on 3 components. The first one being the flexible service delivery, which is the foundation of the Toy for Inclusion work in any context. In this particular context, Ukrainian families arrived after experiencing severe disruption family separation, chronic stress, loss of home, lack of access to routine services, overcrowded shelters, and limited access to childcare and access to preschool and primary school. And at the same time, around 40% of preschool age Ukrainian children could not enter formal ECC in Slovakia and in Hungary due to capacity limits, language barriers, and also the uncertainty of their stay. You know, for how long would they have stayed in the country? So our play hubs, both fixed and mobile, responded by offering non-formal community-based ECC that could be set up quickly. We already had some play hubs and we basically opened the new ones in both countries without too many bureaucratic delays. In a matter of 6 months, we had 10 play hubs in Slovakia and 12 in Hungary, and in 1 year, 15,000 children were reached in Slovakia, 3,500 parents, approximately 30 to 40% were Ukrainians, because these were not services that were open only to Ukrainian children, because the ultimate goal was actually integration and social cohesion. And in Hungary, about 3,500 children and 1,800 adults. About 50% of these children in both countries were under 6, and approximately 50% in Hungary and 30% in Slovakia were of Roma origin. Because especially in Hungary, most of the Ukrainian refugee children and families were of Roma origin. The display hubs became safe, predictable spaces for play, early learning, language exposure, and connection. And they also acted as entry points to wider services through referrals and municipal partnerships. The second aspect of the framework, the preparedness framework we worked on, was the integration of mental health and psychosocial support. So what we did was to create, so we work intentionally on mental health and psychosocial support informed practices with predictable routines and nurturing interactions, emotionally responsive play, group activities to rebuild social connections, and support parents who were themselves overwhelmed. Although the hubs were not clinical spaces, we consider them as restorative spaces that offered play and social connections as protective factors. And lastly, we worked on the workforce capacity and well-being with local partners to ensure that the frontline staff, so the play hub staff and volunteers, were not left alone. So we provided training on the Toy for Inclusion methodology, guidance on the use of the resources. We provided the handbooks, the toolkits, the guidelines. We also supported peer learning through the ISSA network. And we coached the staff focused on inclusion, trauma-sensitive approaches, and community engagement. In general, I would say that the play hubs showed that flexibility, psychosocial support, and supported staff were able to immediately stabilize access to early learning and care for displaced young children, even when the formal systems were not yet able to respond. If I can say something about challenges, play hubs are not daycare centers, they're not preschools, so they are not designed to host children without their parents present. You know, like they are non-formal ECC centers where children and their parents or caregivers attend together. And this was one of the main challenges in this particular moment, because most of as also our friends from Ukraine said, many parents, mothers and grandparents, because there weren't many fathers, had the issue that they needed places where to leave their children while they were searching for a house, searching for a job, accessing legal support services, and so on. So although the play hubs were not childcare centers, so they basically had to adapt to this reality, and they had to be open 8 hours a day, and to accept that children were there unattended by their parents. So that was let's say an adaptation that is not part of the model, but because the play hubs are supposed to work along with the formal educational services, but due to the lack of access to the formal services, there was this need to adapt the model even further than we initially planned.
Thank you so much. When you were saying, I also thought about you actually touched upon it a little bit, like they were not national how to say regulations, the national systems were not ready for it, so that play hubs took part of it. But was there something in place that will helpful for those, and what was needed to be in place to make it more effective to run the play hubs, and can you give us a couple of examples if you have it at the top of your head?
Yeah, of course. I would say that what was in place was probably like a strong NGO capacity and leadership in the partners we worked with. So Scola Dogoran and Partners Hungary Foundation, they were able, in a matter of few weeks or a couple of months, to double the number of their existing play hubs and train tens of staff and open these services to thousands of children. We had the Toy for Inclusion methodology ready, and we were able to adapt it also there in a matter of a few months for the emergency use. We had the local action teams, which are these like multi-sectoral community-based teams of representatives from different services and local authorities already active in the locations where we had play hubs already before, and we were able to create these local action teams using the Toy for Inclusion model also in the new location quite quickly. There was the regional learning ecosystem of ISSA that allowed fast peer support, resource sharing, visibility, all the work you did on the trauma-informed and the first the psychological first aid training. And then we also had the existing materials in multiple languages that were adapted, translated, and that ensured the quality and consistency. There was a wheel of local actors, like local professionals, local families, and communities to respond to the emergency. And then I would say that after maybe around 9 months, the situation actually improved also at the systemic level. So basically the children started to enroll in schools because they learned the language, they were more integrated. Some children never actually joined the local schools because they preferred following the online Ukrainian education. But after this initial 9 months, so in the course of 2023, we saw that the ministries and municipalities gradually adapted and adjusted to the influx of Ukrainian children, and also the role of play hubs evolved. So it was less necessary to host children without their parents. Some play hubs were embedded inside kindergartens and schools, supporting them before and after classes or creating parallel activities for small groups. They remained essential for children not yet enrolled. And they kept supporting and being vital for improving language acquisition, integration, and to provide psychosocial support that was not provided actually by schools. And most of all, they kept being an important bridge for families, helping them navigate services, settle in the new dimension, and rebuild social networks in the new country. What we noticed that was missing in terms of system preparedness, so the gaps, I think that the lack of national ECD preparedness frameworks. This is the first big emergency, you know, in Europe after some decades after the war in the ex-Yugoslavia, basically. There were no formal mechanisms for rapid enrollment of refugee preschool age children, and it was really difficult to expand the capacity, you know, of ECC services in these countries. There was a lot of reliance on NGO initiatives. There wasn't a lot of integration of mental health and psychosocial support within the formal system. There was lack of training also and awareness about MHPSS. There was complete lack of mobile services, so the mobile play hubs actually were quite unique. And also something that we know, emergency or no emergency, the fact that there is a lot of fragmentation in the early years sector.
Julie, thank you. Thank you so much. I apologize. At the end, I was disconnected, but I'm back. So I grabbed what you were saying. You were talking about the lack of preparedness framework in ECDs and focusing on gaps, because we will have to come back also where to go from here. What is the priority to make it more effective, our intervention, when the system is prepared? And you were saying reliance on NGOs and lack of MHPSS, and can you also please say the last point? Can you repeat the last point you said?
Yeah, sure. No, I was saying that the mobile play hubs were unique because there weren't any other mobile services, and the usual fragmentation of the early years services, which is there always, even not in case of emergencies, also played a role in basically not helping with the preparedness.
I see.
Services and sectors were not talking to each other. Yeah,
definitely. So this is something we always come back to before preparing for emergencies. What's in place as ECD systems, right? Yeah. Thank you so much for this overview. I'm also checking the chat if there are any questions specifically for Julia, and if not, again, I would like to move on to our third segment. And continue with the segment of natural disasters and hear about their experiences in Turkey, Assam and Aceh, and hopefully we'll have some time to also have a discussion together at the end. Now, I would like to, before I invite Koray and Betül from Assam and Aceh, I would like to give you a little overview also of their work. This example that we included in the compendium is also they're coming from Turkey. Assam has been providing community-based early learning and psychosocial support to families affected by the earthquakes in February 2023. They supported displaced families living in temporary settlements. Because of the earthquake, there were hundreds of people, thousands of people were, affected, and the access to early learning was disrupted. They had lack of such psychosocial support, and basic community networks were disrupted. And families were in temporary or semi-permanent settlements where formal services were, lacking. They were slow to return, and safe spaces were lacking for children. And they've been working with UNICEF. They operated 26 facilities across 15 provinces, nearly reaching 3,000 children, and they provided early learning activities, psychosocial support. And in 2025, they also expanded. They ensured continuity as communities moved from emergency response to long-term recovery also. Again, as an example of community-based hubs, how they can deliver inclusive services when disasters happen. And I also would like to, before I give the floor, I would like to also give an overview of Aceh's work also during the earthquake. You know, in 11 provinces, many communities were in small settlements, and again, they were facing the problems that I was mentioning. And HF deployed mobile education units, and they were bringing early learning and caregiver support to these areas. Children aged 3 and 6, they received play-based learning, and also women participated in some empowerment programs. But you can also tell us a bit more about those. And mobile units delivered structured early learning programs for children and power program for women. And they had partnerships with ministries and donors that enabled quick mobilization and local acceptance. And you know, mobile delivery can prevent families being left behind in emergencies. With this overview, I would like to invite Rai for something and to
Hello, everyone. I'm not sure if it's IHS connection or my connection is gone.
We hear you.
Okay, I guess there's a problem with hers. So, okay, I guess you're here. I'm worried that I was disconnected just the minute you gave me the word. Okay. Hello, everyone.
for that.
To use the time efficiently,
But please
I will
go ahead.
Okay, I will just jump into the topic. I would like to say that I was really not sure to keep this topic maybe institutional or more story-wise sharing. So actually, I also prepared a presentation for you all, including those lots of institutional informations too. So I guess I'm not going with this, but I would like to, if it's possible, I would like to share just some part of the screen, just I'm going to talk about an earthquake and a disaster caused by nature. And I guess what I'm going to talk cannot be understood if the magnitude of the disaster, the emergency cannot be seen. Because as you said, the affected people is not by hundreds or thousands. The official numbers are declared by billions. So millions, excuse me. So I will share just a part of the presentation. And again, please excuse me. This is kind of end of our day in Turkey. I'm in a field office now, so I will just have 40 minutes just because of the security reasons. We will have to close this facility. So let me see if I can share my presentation. Okay. So I guess everyone is seeing, right? Did I manage to share?
Yes.
Okay, great. So see, this is the ninth page. The previous ones all are institutional page, so I'm just passing those. So emergency. I just added this because it's a very wide definition, and unforeseen combination of circumstances of resulting state that calls for immediate action. That can be anything, my friends. And in our situation, these are the numbers. Just a presentation, just an intro to the story I'm going to share with you. I might get emotional, sorry about that. UNICEF estimates 4 million children affected from these earthquakes, and in 11 provinces, about 16 million people affected by those earthquakes. So those are the areas where we set up our facilities, where people stayed. Just passing really quick, just to picturize in your mind. So we were lucky, as we already have some preparedness for emergencies, and we already have some programs running during that date. And we were lucky that our resources as human resources, vehicles, warehouses, were enough to respond to the emergency immediately. I'm not sharing those numbers current now. So what we have done, okay, mainly, let me just skip to one slide and I will just share you the story of our intervention. The day all those things happens at 6 a.m., we all received a call. And for such a magnitude, you cannot be prepared for anything. In the first day, we just build a crisis management team, and then we just mobilize our teams to the field for the needs assessment. And of course, we also have a rescue team with cannons. They also deployed to the area. And the most hard thing, now the story begins. We thought that we can have an assessment, needs assessment, but it was impossible because everything was just collapsed. So there is a state of emergency, and people cannot help you to give you information. They're just trying to survive in that situation. Well, those days are past, and how the things shaped for the early child education. Those are just for picturizing the situation in your minds. Well, we were lucky enough that we were developing a non-formal education program during when the earthquake happened, and thanks to our donors, when our first assessment data arrived, we shared with them, and we quickly implemented an early childhood education component to that program. And of course, what we have done, we need lots of new sources, the data, the curriculum, the people who are going to implement it. Well, we just realized that we were supporting people in early childhood development, but just in physical development and health and some social and emotional development context. Those are kind of part of the services we serve as child protection services. Well, from that day, we hired professionals. We contacted with universities, professionals, and also UNICEF really helped us a lot during that time. We were not a member of the ISSA network during those days, which we have. Maybe there will be lots of professionals who are going to support us. Then we start building a specialized curriculum which we can implement in affected areas. It was really hard because you don't have opportunity to tell a child, okay, there's an emergency, stop growing. That's not an option. But when the things happened, when that emergency happens, all the things serving them, the systems that protecting their safety, providing learning, and keeping their connection alive, suddenly stopped around them. And UNICEF just published a report a few days ago, the early child attendance around the world. And if I remember correctly, the early child attendance numbers in, I can say, normal days, not an emergency situation, around 30% for Turkey, and the world percentage is around 30% too. So even that number is no. Just imagine the situation in emergency situation. So the families cannot provide the children a safe place, even not a safe shelter. Let me sum up what we have achieved. So, well, we I cannot say discovered, but I can say that we just realized the early childhood development context in regular days is really different in emergencies. I would just like to share this slide because this is how things are shaping. For the physical development and health, yes, healthy growth, nutrition, immunization, and motor development, just regular things with regular partners. But then when emergency happens, you need life-saving nutrition, safe water, because they cannot access safe water. All the water sources was infected during those days. So we worked with local authorities. We have to stabilize the basic needs at first, shelter and the basic needs. Then we can start providing other services also in the name of the early childhood development too. So those took some time, I guess 6 to 8 months passed by the basic needs, clean water, shelter. During the first days, people had to stay at the tents. Then they transferred to prefabric areas or container cities. And even we built some safe spaces at the tent areas, but those mostly safe to provide a safe space for the children. You cannot offer more complicated or more structured programs at the tent areas. It was just some place to bring just a little normalcy to their lives. But when we transfer to the container cities or prefabric areas, then things get more serious. With our specialists, I also invited them to this meeting, but they have other plans, so I wish they were here and they could explain the approach our approach when designing the curriculum, because I guess it was the most important thing. With UNICEF and the local authorities, local schools, Ministry of Education, we designed a curriculum based on the activities, based on the life skills, soft skills, to support those children, because this is the only thing you can offer in a very limited area. Let me just show you some spaces, I guess. Yes, those are from the prefabricated areas. You can see the places are really small, and you have to organize everything. So the most difficult thing was planning and organizing and trying to cover the demand of people living in the area just with a limited source. I can show you just one more number. In the tent areas and also in the container cities, we both served Syrian and Turkish children, and in total around 3,000 children benefited from these activities. So just considering time, I'm just trying to focus on where to cut and which to mention. So when that program ended, just because of the funds, we just realized that we have to sustain this curriculum, these services. And what we done, even that project was completed, we just spread that curriculum to different projects. In 5 different projects among Turkey. Of course, they are all lot smaller, but they are still 3 of them still serving in the earthquake region. Kept providing those services to affected families and children. But moreover, more of that, what we done was we keep improving the curriculum based on the needs of the families and the children. At first, everything was started with just providing a safe space. And in the second phase, we provided them with structured programs, and then with the universities, we just collected statistics of the effects of those structured programs for the children. Then with that data, we see the missing parts. And now with these new programs, even they are smaller programs, what we are doing is we are now the families are now part of our curriculum. So we now have home-based activities, family-based activities, and what we are doing now is we already start structuring and improving the curriculum for the next years based on the data we have collected. So I guess I have just 20 minutes, and for now, maybe there's a little outcome I can share with you. By the structured programs, here are the developments we observed from those children. Those numbers are pretty encouraging us to keep going. So these interventions are working. This number says that these interventions, these programs are working, and now we are trying to improve them, and we keep trying to sustain the program. So yes, that's all for now.
I'm also mindful of the time. Yes, I think it gives an overview of about and I understand, at least from my side, like the challenges you've been facing, but also the facilitators that you've been getting, the support you've been getting when doing this work. Thank you for giving us more in-depth information about this work.
There are lots of technical information, but I guess it's
yes,
and lots of details I would like to share about how to organize, how to get prepared, and we are also preparing reports for the state, just to implement an early childhood intervention plan to the national emergency plan. So that's really important. The key sentence is children cannot stop growing. Doesn't matter what happens. And the early childhood years are really important for their future development. So as an NGO, we were lucky. We worked together with all the stakeholders, shareholders at the area field, and we were lucky. And we are not sure when the next time will happen. Hope not to, where to happen, but wars and natural disasters happening everywhere in the world. So yes, we have to get prepared as much as we can.
Yes, great suggestion. Thank you, Koray. And I'm seeing that there's some reactions also coming from other colleagues here. Like, please share, please, give us this information. If possible, share the slides also. I think,
I can share the slides.
If you can share with us, maybe we can share with the participants later on. If I'm not mistaken,
I can. We also have some reports, some annual reports about about earthquake, about education. So I can also share those materials too. I just have to get a confirmation from our manager.
Of course, let us know.
But most of them are also public. So I would love to share this information with all of the members.
You can direct us to the links also that we would love to also share towards our members if you have other links that you want to share. I mean, thank you so much for this. I'm mindful of the time also, that I want to give some space also to Acef, to Betül, and then we still have other members to talk about the pandemic segment at the end. So if that's okay for you, we would like to hear from Betül, her reflections, a bit about Acef's work also. Do you see similarities, differences, similar challenges as Koray mentions? Betül, also, can you please also reflect a little bit what has been shared as well. If I can
Okay,
invite
thank you very much.
Yes.
Thank you very much, Ayça, and also thank you very much, Koray, because you perfectly show how the earthquake crisis was big. So I won't tell again the earthquakes situation, but what did we do? I'd like to tell something about that. After earthquake, we rapidly visit the earthquake region and we try to make a need assessment. And we decided to establish child and family centers in the region and also operate the mobile units and also ECD kits. Our primary objective was to support the early childhood development and also well-being of the children by providing safe learning environments and also parenting support and also psychological services. Our programs are designed within the framework of nurturing care, addressing the children's health, nutrition, and overall well-being. So through the holistic approach, we aim to enhance children's cognitive, emotional, social development, but while also empowering their caregivers, particularly mothers and fathers, to provide nurturing and stable care despite the all challenging situation after the post-disaster. After the earthquake, after the 4 months of the earthquake, we established 3 child and family centers in 3 cities in the earthquake region. As Koray mentioned, that the earthquakes affect 11 cities in the region. So in 3 cities, we established our centers in the container settlements. And also we operate 3 mobile units in the region to reach the children and their families in the rural or faraway settlements. Firstly, the main elements of our preparedness framework is the service delivery and access. By establishing family and children centers and also mobile education units, we aim to ensure continuity of early childhood education and parenting support. In our centers, in our physical centers, we are implementing our ECD programs for 4 and 5 years old children. Our ECD programs is implementing more than 25 years in our another center in Diyarbakır. But after earthquake, we made some revision in the program. So we implemented the new version of the program in our classes. In our centers also to support children between age 3 to 14, we established toy and book libraries in each center. They were equipped with toys and books to support their development needs. And also the library is also used quite study space for children age for school-age children, because as you guess, the containers, their living spaces are very limited. So sometimes they are living 5 or more 5 people in the very small places. So they need the quite study spaces. So our libraries serve as a study space for them. To expand our reach, to reach the children in rural areas, we operate 3 mobile units. We developed a structure program last 6 weeks. Based on our ECD program, which is implemented in our centers. So we are going to rural and the other container settlements by mobile units for 6 weeks, we implement our programs with the children living there who have no access early childhood education opportunities. And also, as a light emergency response for children who have lost their toys, their books, we developed ECD kits. ECD kits is a box including toys, books, some Play-Doh, some the drawing pencil and coloring notebook. So we distributed this box in another container cities and rural areas to support the children development at home at their living spaces. So we also developed and distributed these ECD kits. The other elements from our framework is caregiver support and capacity building. In our centers, we implement mother support program and father support program to strengthen their parenting skills, but also increase their well-being and their resilience. We aim to support them to able them to support their children development, interfamily communications, and also family endurance. Parent support programs had an impact on mothers and fathers' lives, including increase their knowledge about child care and also social support resources and enhance their social interactions. Maybe I can show a video. I'm not sure is it possible, but it's very clear to show our works.
We can,
Let
but
me try.
yeah, is it long?
It takes only 1 minute.
Okay, then we have 1 minute, of course. Yeah.
Yes, yes. Wait, please.
And if you have questions, please write in the chat also.
Yes. Can you see? I'm not.
Now we can see, yes, it's a bit late, but yes, we can see. If there's a sound, I don't hear it though, but maybe we can.
Yes, yes,
Yeah.
but it's not important because
Okay.
no one is looking.
Please share the link if you can reach out to.
Yes, sure. Yes.
Thank you so much.
I will also share the link if you are interested.
Yes, please. I mean, we invite you and all members actually to share if they have further with us and with other members as well. And we, as I said, also we want this compendium to be a living document, so our experiences continue to grow. So we invite all of you to kind of contribute and make this a reality, this growing, a base where we can feed more information and we can share more information and find also others who are interested to share and learn. Yeah, thank you so much, Betül. I'm sorry. Do you want to add more, or should we?
No, No, but just lastly, I can say that these initiatives highlight the lessons. Maybe I can say that the lessons learned for us. The rapid structures and child-focused intervention are very essential, particularly after the emergencies. Supporting caregivers is equally important as empowered parents create resilient environment for children. And also mobile and ECD kits are very inclusive approach, which is critical in reaching underserved population. Maybe I can add lastly this verse.
Definitely, thank you. It's also, you know, in every part, it's holistic. The parents, the caregivers, the workers, the workforce, and everybody who is in there. That's why we want to kind of have strong systems in place so that we can reach out to every stakeholder, every actor who has a role in this. Thank you so much, Betül. And but might be mindful of the time, I would like to move on to the last segment, which we wanted to give a voice to Amna. Gabriela, I'm going to give you the floor, but also we have our members from Bulgaria, Trust for Social Achievement, Linka, and Rosica from Rice International, and also from Step by Step Albania. Gerda will be telling us some insights. Again, I would like to give you a really short overview, starting with Amna. Gabriela gave us a little bit of information about their work earlier, but they had, during lockdowns, they had Baitna, correct me if I'm wrong, Gabriela, Baitna centers, and they were supporting refugee families. When the physical spaces closed, they needed to adapt for more, video resources, songs, stories, movement, and activity guides, and they were trauma-informed, identity-informed materials and support systems that they were putting in place. And also, similarly, when COVID happened in Bulgaria, they had to adapt because families were cut off, especially vulnerable families, Roma families, from learning and developmental support. And they mobilize their community organizations to keep the services going, to make them inclusive as possible in that sense. And they were working with Worldwide Foundation and in the Trauma Import Element of Play program, and they were convening into a stay-at-home, play-at-home model that they gave caregivers practical low-cost play ideas, that the materials that they can use at home. And, through the partnership, they highlighted the importance of flexibility, collaboration, and play-based approaches in crisis situations. And lastly, I would like to give a little bit of information about what Step by Step Albania did. During the lockdown, educators, they were forced to shift to remote teaching without preparation, without national guidance or training systems. They responded immediately with a holistic approach that addressed both technical and human sides of the crisis. They provided webinars, digital tools, guidance on platforms like Zoom or Google Classroom. They helped the teachers cope with stress and uncertainty. They strengthened peer networks to support each other. And they were helping bridge literacy gaps, especially in Roma communities. It also shows how, quick responding and it also shows the need for systems in place, not only the fragmented intervention efforts, but in general, the teachers will need to be supported by their work. So I would like to open up again this segment by inviting Gabriela to give us a bit of further information, and then I would like to continue with our members in Bulgaria and Albania.
Thanks again. I will just keep this really brief because you actually covered a lot of it, and I know that there's other people to talk. I also want to say, just acknowledge the incredible work of this community and everyone presenting and everyone who's not presenting, and just the level of care and creativity and integrity and commitment that's in what everybody is doing, often in incredibly hard circumstances, and just the thoughtfulness and love that is also evidently behind it. So respect and gratitude to everyone. I think, like many of you are sharing about your interventions, ours is really focused on creative and collective healing tools and practices. And underpinning all of Amna's work is really some of the essential ingredients that we feel are important, or we've learned are important to healing, which is connection, which was something that COVID really, really hindered. Belonging, feeling part of a community or a group of people that really care about you, and particularly for refugee communities and displaced communities, far away from loved ones and their familiar contacts. This is more important than ever, especially when people are existing in very hostile environments where their experiences are not validated and not cared about, and there's all sorts of discrimination, macro and micro. And actually an essential ingredient for Amna is also joy as well, and not kind of fake happiness, but really interventions and spaces and relationships that can really help joy to reawaken, which is a casualty of overwhelming kind of grief or trauma or loss or displacement. So what was really important to us was to find ways in COVID to make sure that services didn't stop because of the COVID lockdown environment, but also especially for communities that were really being, like, in some ways the most neglected, they're the communities that are often least cared about, least invested in, and actually having that service, that facilitator, that call, that home visit, whatever it may be, is often a bit of a lifeline for many people. And so one of the things that we did at the beginning of the pandemic was to do a quick needs assessment and talk to different communities and find out what the impact was of COVID on them. And so many of them spoke really deeply about just that intense isolation and loneliness, and the escalation in mental health as well, because of how just the structures and the places and the relationships and the formats of day had kind of really disappeared. So we did a number of different things, which you've spoken to, Iko, in the compendium, but just, we so we did a few things. Some of them was really gorgeous, which is we had amazing skills across our facilitator network, and so we made these home videos, and the music therapists and music healing people made music videos, and the movement people made movement videos, and suddenly we all became awkward YouTube stars. That, I'm joking, that we weren't really stars, but we created together collectively like a set of resources that we could then share with our different communities. There was like familiarity. We did them in different languages. We did like meditations, and we also did things audio, visual, and PDFs, so that people with different connection capacities could access them, and centers could also print them out or watch them together or use them as part of the tools. And that then created a sort of resource book. Some partners did home visits in camps, and just they went and visited on the doorsteps of people's homes or in the camps, and they took Baitner to their door, and that made an incredible difference. And then sometimes it was phone calls, and what community members said was just the difference it made having that call and somebody caring and checking in. And I share that because we know this in this community, but sometimes the very little effort that's actually very easy to administer makes a really big difference for somebody, and it's something that helps them in the moment, but also something that they hold on to as a memory, which is part of a healing journey as well when you look back at a very, very difficult time. And then the other thing we did was we put in place therapeutic groups. So we put together, particularly, we found that a lot of men and male caregivers were really struggling. I know this is an area that ISSA has been working on and really kind of advocating for this year. and we hosted different groups and for men, for women, and we had in our team, and we found really aligned therapists who we trained, who have a qualification, but then we provided additional training and supervision to hold the space. And in some ways, it was a higher safeguarding risk doing that work. But what we found is that people who would otherwise maybe never have that community got that community, and also that community could accompany people through quite a lot of different transitions. So one of the groups that I actually ran for 4 years, and we had group members who moved countries and they dropped in and out of the group, but they had that accompaniment over that period and through their different stages of displacement, which was really significant. I could say more, but I'm going to stop there so others have space. Thank you.
Thank you for these insights and information. And these are, amazing, extensive work, definitely. We hope to continue this conversation, as I said, later in different areas, online and through emails, and I hope it's not the end. But I would like to invite Linka and Rositza also to reflect a little bit on their work and tell us which areas they worked on, and their learnings and challenges, what was in place and what was needed.
Yes, hello. Maybe I will start. Thank you, everyone. Thank you, first of all, ISSA, for organizing this event and just for making the space for a dialogue about this topic, which I believe is extremely important and timely, because we are in a context, and we have been for a while, in a context of, some would call it a polycrisis, a crisis with many dimensions, particularly regarding young children in so many contexts around the world. We are presenting together with our colleagues from Worldwide Orphans, formerly now RISE, and Rossi was not able to join, but Puamena, her colleague, will be joining us. So we will be sharing very briefly. I'm very cognizant of time, and I hope we have more time for discussion, just some concluding discussion in the end. So I will just briefly want to mention that the Trust for Social Achievement, as you know, we are a grant-making organization, but for us, empowering the communities in Bulgaria, which tend to be overlooked, is a very important priority. We focus, as you know, particularly on the Roma, and trying to work on breaking this cycle of poverty, which we believe it starts very early. And this is why we partner for many years now. We partner with RISE Bulgaria, because they also share this vision, and they have a very common mission to TSA about the well-being of our children today, which is the foundation for our societies in the future and the potential of our societies. And we have seen in those challenging times during COVID, but also the economic crisis that followed after COVID, and we're still recovering from all those challenges in Bulgaria. And we've seen that it's so important to start early and to focus on the early years if we want to steward the potential of our societies. What we focused on during COVID, I would say maybe it was this element of preparedness, which you call flexible service delivery. And many of the people who spoke before us mentioned this very strong importance of flexibility during crisis. And COVID was one of those really prime examples of how, when systems are inflexible, everything tends to break down when they're facing stress. And we were working with RISE colleagues and with many local partners, because RISE was supporting with know-how and with their trauma-informed play-based programs, and with providing supervision and insights, but working with a network of people and facilitators on the ground who are in those communities. And it was important for us to really very fast change our mode of operation. RISE will speak later about how they developed a new program that is home-based, trying to think outside the box of what is possible to make sure that those children who are underserved in regular circumstances, what can we do for supporting them in times of even further challenge? And the challenge was accessing the children under COVID measures, which we're talking about Roma, very poor communities, underserved communities, and how could we ensure some continuity of child development services, because the national focus was on keeping the school system working, making sure that children are not left behind in school, and providing digital devices and trying to provide connectivity. But the early years were this moment of that was under prioritized in our opinion, and here some of the lessons that maybe we can share later if we have time. Give the floor to Pwami, if you can jump with some concrete examples of what you did.
Thank you very much, Linka. Please, Blema.
Yes, thank you, Linka. Hello, everyone. I'm really sorry that I had to leave the office and switch to mobile, but I hope you can hear me clearly. Thank you for the invitation. I think it's a great opportunity to really, 5 years later, to really go through all the crises that happened since 2020, unfortunately, and to see how we can support people, how we can support children ahead. What we did, as you mentioned, as Linka mentioned, we turned our signature program, the Element of Play, which is play-based activities for early learning childhood, to a home-based program. We first developed this like very simple guidelines for practitioners and for parents who work with for their children. And we also made these small like boxes or packages with toys and very simple materials that everyone could find in their home. And we did small instructions how to actually use the things that are around you in every home, because in many of the homes of these communities, there are not development toys or expensive materials or even books sometimes. But there are also always some everyday objects that parents can use or caregivers can use to develop the child and to help and support and continue learning. So this is the second thing that we did. And the third thing was to record videos with storytelling and storybook reading. And connected with this, we work with the municipalities and our local partners that work on the field to ensure that there is free access to internet, because even in the maybe not the poorest, but in most of the communities, everyone has at least a smartphone. So we realized that this is the easiest way to actually connect and support. And basically, this is what we did. We tried to really go out of the box and to adapt with the situation. It was really hard because, as Linka said, the systems are very old-fashioned, very rigid in Bulgaria, and they are not really working well supporting children in times of times that there is no crisis. So they were hit very badly, really during COVID, and afterwards, almost immediately with the war in Ukraine and all the refugees children that came. So it was like a maybe 2 or 3 very long years of constant push of the non-governmental system and all the support systems in Bulgaria. So we had to do whatever is possible to really jump into this situation. So I just want to keep very brief, not to go over the time, but if you have any questions, yeah, I'm here.
Hi everyone, I just frozen again. She's reconnecting and will be back with us shortly.
I think I'm back. Leman, thank you. Thank you so much. Yeah, I'm sorry. It has to be short, but I think you really pinpoint very important issues that the systems already should be ready for children to be able to respond meaningfully when the disaster strikes indeed. And looking at the time, I would like to also give the floor to Gerda to talk about their experience. Thank you, Gerda, and thank you for your patience being the last speaker. And time flies. I mean, we have a lot to discuss. We need more, and maybe I can ask 5 more minutes also of all of our time, if it's okay for the participants as well, so that we can give you a good space for you too, and then we can close. Yes, please, Gerda, the floor is yours.
Yeah, so thank you so much for giving me this opportunity. It's such a pleasure for me to share our experience from the COVID-19 pandemic and reflect through the lens of a system preparedness framework. So the pandemic revealed that we were not ready. It's we heard this time and again during all the presentations today. It was the same shock. Services stopped overnight. Families were isolated, and support structures were simply not ready for a crisis of that scale. The pandemics exposed two parallel realities: the extraordinary dedication of education and parents, and the fragility of the systems meant to support them. Our work at Step by Step Albania during this time focused on helping educators, parents, and children maintain connection, learning, and well-being despite the disruption. So first of all, the service delivery in order to be resilient and flexible. We did not use digital tools in early childhood before the pandemic. So it was very clearly, very fast that the resources were unevenly distributed. Many educators lacked support and capacities to use remote delivery, and families had completely different levels of access and digital literacy. So we tried to produce simple, low-tech, developmentally appropriate materials for home-based learning, and a record video demonstration for parents of young children, which could be used also in rural and low-income areas, and supporting educators to adapt child-centered pedagogy to virtual or phone-based interactions. These efforts only compensated, but they did not replace the need for systematic digital readiness. The second component was workforce capacity and well-being. The pandemic placed significant strain on the early childhood workforce. Educators were suddenly expected to redesign teaching, support stressed families, and manage their own household responsibilities while receiving very limited guidance. We observed that many educators felt isolated and unsupported. There were no structured mechanisms for emergency training, and emotional well-being was often overlooked. What we did was to provide short practical training sessions on remote facilitation and parent communication, and we created peer support circles for teachers through informal WhatsApp group, but also webinars. These spaces became essential for sharing solutions and reducing burnout. The second level was on the mental health being. So the COVID-19 was not just a health crisis, it was a psychosocial crisis. And parents feared for their jobs and health. Children experienced anxiety, disrupted routines, and social isolation. So we try to train teachers to to guide parents on how to establish routines and to enjoy this very strange opportunity to stay together for a longer time and to get to know each other better. Playful activities, targeted emotional expressions, and advice for teachers on recognizing stress signals in young children, even through the screen, which was so complicated, so difficult, and it was only reactive. A preparedness system needs to have these social, emotional health, well-beings at the core, and not just as an emergency add-on. The fourth element was on governance, coordination, and accountability. We found that schools, government tried to act, But it was not fast and it was not predictable. Policies changed way too frequently. Communication channels were unclear and roles were not predefined. So if there is one lesson we can take forward is that ECD governance must plan for crisis readiness, and that's why I'm so excited about this compendium. This is these compendiums should have the crisis readiness protocols in place, not just in stable times. Clear protocols, clear role and communication pathways would have made the intervention much faster and much more effective. So what was missing and what we learned? We had one important insight. We cannot build preparedness in the middle of a crisis. Preparedness must already be there. We lacked ready to deploy digital learning frameworks, emergency-oriented training for the ECD workforce, structural support for family well-being, and flexible funding mechanisms that allowed quick actions. Yet the pandemics also accelerated positive shifts. It increased awareness of the importance of early childhood, it strengthened partnership and sparked new creativities in reaching families. There are several things that still remain a priority. Our most urgent priorities are to systematize digital readiness in all early childhood services, and we're still very far behind that. We lack digital literacy in teachers and other early childhood experts. Second, to institutionalize ongoing teacher support on emergency training. Things happened and then they stopped. We need to have these kind of protocols that teachers are trained in times of calmness so that they embed and internalize these kind of protocols without fault. Integrate services on mental health and social emotional support into regular early childhood practice, not just as a crisis response, and build coordination mechanisms that remain active and functional in emergencies. Of course, these are very important priorities, but if systems are prepared, children, especially the youngest ones, are better protected. I try to be as fast and schematical as I could. I hope I managed to get through, but I know I'm between you and the rest of your life, so I hope I got through too much.
No, thank you. Thank you so much. I mean, you actually also provided what we were thinking, you know, what we wanted to close with. You were saying the ECD system already should be competent so that it can be prepared. You said actually what should be the priority. I would guess that in all of these colleagues' contexts here, these will be applicable, what we are saying as a first priority, and cross-sector collaboration, the coordination should be there, the collaboration should be there. So, you know, the one main lesson, whatever we do, is that we come back to that over and over again. So thank you very much for this overview. I think all of the colleagues would agree as well. Thank you so much.
Thank you.
The time passed really fast, and it shows there's a lot to discuss. There's a lot to exchange. Maybe in the future we will be continuing this conversation. One way to do it, indeed, to stay in touch with us, stay in touch with our colleagues, stay active within the ISSA network, and you know, keep feeding your experiences, learn from each other, and please explore the compendium. And before we leave, I would like to invite all of us actually to kind of reflect to the first question that we did at the very beginning. How well prepared do we feel to support young children during an emergency now? And my colleague will help sending you the Mentimeter she just did. If you can go and reflect, and in the meantime, I would be closing, first of all, starting by thanking all of you for being here, providing your experiences, providing your insights, learnings, contributing to this community. This is very valuable for us. This is huge, actually, that we can get together, still do this together. And before closing, I will also like to say that being a network, as we can see, it's kind of carries us one step forward, and we would like to call you, as a call to action to visit the website, download the compendium, talk about it, use it in your work as well. And one important thing is that we were sharing our learnings from our region, but there's a lot of other networks who are also working in this in different parts of the world. So it's also important to reconnect with them and learn from them. So as ISSA, what we're trying to do is also bring learnings from their experiences as well. So we would have to acknowledge them. There's every time you see there's a lot to learn and exchange because disasters and emergencies are happening everywhere. And some of you know already this conversation. We would like to continue this conversation under ECHOS Institute, our new institute that we're establishing, and we're really excited for 2026. And there will be more opportunities to talk about these issues. And please feel free if you have ideas, if you want to talk about it, if you have questions about it as well, how we can continue these topics under the institute as well, and how we can share our expertise there. And I want to share really quickly the responses coming in. I hope there's a bit of increase. I see we just increased the 1.0 from 5.9 to 6. So it shows there's a lot of work to do for us to feel prepared, be prepared, to push our work and push our governments, push our national context to be prepared as ECD professionals. And I would like to stop here and thank you once again for being here. We hope to be in touch, and we'll see you in other events, and looking forward to hearing your work. Thanks a lot.
Thank you so much.